Okay, so let's talk about something that can turn a parent's world completely upside down. A diagnosis of Opsoclonus myoclonus syndrome, or OMS. It's confusing, it's scary, and it happens incredibly fast. Our goal here is to cut through all of that, to replace the fear with some clear, straightforward knowledge. Let's get right into it. And right away, this quote just hits you. It perfectly captures how unbelievably fast OMS can strike. You're talking about a child who's maybe just a little wobbly, and then in a matter of days, sometimes weeks, they're in the hospital. Unable to walk, unable to talk. It's not a gradual slide. It's like falling off a cliff. The speed is just terrifying. So what does this actually look like? Well, you can think of it as a sudden, violent storm that just descends on the nervous system. It isn't just one single thing. It's this triad of problems that show up almost overnight and get worse with shocking speed. And if you can get your head around this triad, you're on your way to understanding OMS itself.
All right, first step in that triad is something called Opsoclonus. And I want you to really focus on that word, chaotic. We're not just talking about shaky eyes here. These are rapid, completely random eye movements, darting up, down, side to side. There's no rhythm, no pattern whatsoever. It's a really unmistakable and frankly alarming sign that the nervous system is in total disarray.
Next, we have myoclonus. The best way to picture this, imagine these little invisible shocks zapping the child's muscles. They're sudden, involuntary jerks that they have no control over. But here's the really cruel part. If the child tries to do something on purpose, like reach for a cup or a toy, the jerks actually get worse. It completely sabotages any kind of controlled movement. And the third piece of this triad is ataxia. This is basically a profound loss of balance and coordination. A child who was running around maybe a week ago might suddenly have this really wide, wobbly, unsteady walk. In the most severe cases, they might not even be able to sit up on their own. So you put it all together, the chaotic eyes, the muscle jerks, the loss of balance, and you get this devastating picture of a nervous system that's just under siege. Okay, so you see these terrifying symptoms. The big question is, how do doctors actually figure out what's going on? Well, it's not a simple blood test. It's more like detective work, piecing together clues from different places to solve a really complex medical mystery. Let's look at how they do that. And this detective work follows a pretty clear path. It all starts with what the doctor can see. That's the clinical examination. They're looking for that classic triad we just talked about. But that's just step one. From there, they'll use imaging like MRIs to hunt for a hidden cause. And they'll also look at the spinal fluid, searching for specific markers that basically scream immune system attack. Each one is a vital clue. Now, this is super important for understanding how a diagnosis is made. It's what's known as the 3 of 4 rule. Basically, doctors have a checklist of 4 main features. But here's the thing, they don't need all 4. If a child has 3 out of the 4, say the opsoclonus, the myoclonus, and some new changes in behavior or sleep, that can be enough to make the call. Even if they haven't found a tumor yet, they don't have to wait for every single piece of the puzzle. So why all the focus on finding a tumor? It seems kind of separate, right? Well, it's because in about half of the cases in kids, OMS is what we call paraneoplastic. Now, that's a fancy word, but what it really means is a tragic case of friendly fire. The body's immune system discovers a tumor, usually a neuroblastoma, and mounts an attack. But in its zeal, it gets confused and starts attacking the nervous system too. That's why finding and removing that tumor is so critical. It's part of treating the whole shebang. Okay, so a diagnosis has been made. What happens next? The response has to be immediate. The goal is to shut down that haywire immune system and fast. And we're not talking about one single pill. We're talking about a full-on, coordinated, 3-pronged battle plan to stop the body from attacking the brain. And you really have to understand, this isn't a quick fix. It's a marathon, for sure. The consensus is to hit it hard and fast, starting aggressive therapy within just a couple of weeks of diagnosis. That first 6 months, it's intense. But even when things start looking better, the treatment keeps going, often for a full year or even longer, before they can even think about slowly, and I mean very slowly, tapering off the meds. It's a huge commitment. So what's actually in this battle plan? It's basically a 3-part arsenal, with each weapon doing a different job. You've got corticosteroids.
Think of these as the firefighters rushing in to douse the massive inflammation. Then you have IVIG, which is like bringing in reinforcements of good guy antibodies to help restore order. And finally, you have rituximab. This is the sniper. It's a targeted therapy that goes in and takes out the specific B cells that are producing the bad antibodies causing all the trouble.
But here's the thing. It's not a one-size-fits-all approach. Even with this powerful 3-drug combo being the gold standard, doctors have to be smart about it. They really act like field generals, tailoring the treatment strategy based on one thing: how severe the child's symptoms are when they're first diagnosed.
And this chart shows you exactly how that works. It's all about matching the response to the threat. If you have a child with severe symptoms, they can't sit, can't stand, you come in with everything you've got. The most potent 3-agent therapy. For a moderate case, you're still likely using that 3-drug combo, but maybe tweaking things a bit. And for a mild case, maybe you start with 2 of the big guns and keep that 3rd one in your back pocket if you need it. The bottom line is simple. The worse the symptoms, the more aggressive the treatment. All right, so getting those initial symptoms to calm down is a huge, huge victory. But it's really just the end of the first chapter. The story isn't over. The next phase is all about the long haul, understanding what remission really means and how you navigate the road from here.
Okay, this is a really critical distinction to understand, the idea of remission, because there are 2 types and they are not the same thing at all. Remission on therapy means, yeah, the symptoms are gone, but that's because the medication is still actively working. The real goal, the finish line, is sustained remission. That's when the symptoms are gone and they stay gone long after the therapy has been stopped and is completely out of the child's system. That's the win.
So on this long road, there's a really important number to keep in mind. 2 years. That's how long experts recommend waiting after stopping all therapy before reintroducing routine immunizations again. And you might think, wow, 2 years. But it makes perfect sense. You have to give the immune system a long, long time to calm down and fully stabilize. It's like you wouldn't throw a big party in a house right after you've put out a huge fire. You want to make sure everything is truly settled and safe first.
And that brings us to the long-term realities. Life after the initial OMS battle is really a life of vigilance. Relapses can happen, sometimes years later, and they can be triggered by something as simple as the flu. That's why the follow-up is so critical. We're talking periodic imaging to check for tumors and regular blood tests to keep an eye on how the immune system is recovering. It's all about staying proactive and one step ahead.
And all of this really leads to a pretty profound question, doesn't it? For a condition like this, where you achieve remission but always have to be watchful, where time and stress can challenge that peace, what does a cure truly mean? Maybe it's not a single moment in time, but rather a continuous journey of vigilance, of resilience, and ultimately of hope. Thanks for joining this explainer.